Good morning. In this episode, I'd like to talk about symptoms and diagnosis. Um, as I've talked to a lot of people in the cancer treatment centers that I was first going to when I was diagnosed, it seems like everyone has a diagnosis story. Some of the symptoms that I first had that kind of was raising a red flag is I was extremely tired. And of course, people would say with age you get tired and it's not a concern, but it was a concern because it was almost I was getting tired to the point of passing out. Some of the other early signs is I was when I would go to the bathroom or I'd urinate, I was peeing straight blood. We at the time I was consulting a doctor. He sent me to a urologist, and they run some tests and for about a month and never could figure out the problem, and then it quit. So they decided I was good, and I had at the time I'd been experiencing bone pain in my arm and in my thigh. The bone pain is a typical cancer symptom. Doctors, all of the doctors in the U.S. that I went to dismissed it as being a muscle pull or something, but having been an athlete my entire life, it was a dull ache underneath the muscle, and in both those places, in my arm and in my leg, after a year, I ended up getting growths in both those places, or tumors in both those places that I was having bone pains. But those symptoms must correlate with a lot of other diseases. It took, and I hear the same thing from a lot of people, is it took the doctors of the medical community a long time to diagnose me with stage 5 leukemia or end stage leukemia. It took them 14 months. I went to 4 different doctors. And believe it or not, because I was tired and everyone was blamed a lot of that on age. They're like, you need to go talk to the hormone therapist and they'll give you testosterone shots. A little background on testosterone shots: they won't give them to you without blood work. So that's actually who ended up finding out that I had cancer. Is I went to get testosterone treatments or to be evaluated for testosterone treatments. They pulled my blood, and 3 or 4 days later they called me back and told me I had cancer. And again, this had been after a year and 3 different medical doctors telling me they didn't know what was wrong with me, that they didn't know what it could be, and I looked healthy, and we didn't have any path going forward to figure out what we were going to do. Now, after I was diagnosed with cancer, the medical community, since it was untreatable, I felt like I was treated like I was disposable, because no one wanted to tell me what to expect. Nobody wanted to tell me how long I was going to live for. No one wanted to tell me, even guesstimate anything. They just sent me on my way, sent me home. And I understand that's a frustration, and at the time you don't know whether you're going to live 5 seconds or 5 months or 5 years. So at that point, the cancer was progressing, and when I would go to Mexico for stem cell treatments, I would complain about the symptoms that I was having, and the cancer had gone gotten into my spinal column and gotten up into my brain. So it was, I was having a very difficult time with my balance. And I would also have a very difficult time with my short-term memory. I would go into a store to purchase something. I'd find what I need, take it to the counter, pay for it, and then turn around and walk out and leave it sitting on the counter. And some people say, well, I do that all the time. Well, I never did. And the cancer did not affect my long-term memory. It didn't seem to affect it at all, but it did affect my short-term memory. And when I say short-term memory, I'm saying about 5 minutes. So whatever happened in the last 5 minutes, I had a difficult time remembering it. And my legs started swelling up. In the afternoons especially, I'd have to take my boots off and because my feet and legs were swelling up. All of this stuff, and again, they didn't tell me, but when I got researching it and talked to the doctors in Mexico, this was just a typical advancement of leukemia. It travels in your blood, then it gets to your spinal column, goes to your brain, then it progresses, or in my case, it progressed down into my liver and pancreas. So, and you've got it in your lymph nodes under your arms and behind your knees and stuff. So you're getting swelling and numbness in your legs. But all of these things, when I got researching, when I actually talked to the doctors, was well, this is just normal. It's just cancer. It would have been helpful to me, I believe, if there was one doctor that would set me down and said, okay. Because, by this time, you've already heard you've got terminal cancer, so you've come to the terms of how to accept it and what you're going to do with your life. But for them to sit down and say, okay, this is probably what's going to happen. And I understand every case is different, but the symptoms I had must be fairly similar. There must be fairly ordinary because the medical community, when I started questioning them about them, they're like, oh yeah, that's just what happens when you have leukemia. Well, that's fine. How about telling us up front, anybody that's got a terminal disease, what to expect, so we would know whether it's usual or unusual. And as it progresses, it gets harder to breathe. Your blood gets crappy where for some reason it can't pack oxygen. Like say you don't have any platelets, and I had critically low white blood cells, so I wasn't a candidate for any treatment at all for leukemia. And because of my age, anybody over the age of about 55, it's kind of a death sentence because they apparently have tried treating it in the past and they've had no success. It's usually about 100% kill rate in 3 years. That's why, we had progressed to the point that they were going to send hospice over and basically started injecting us with morphine when I started self-treatment. Now here we are almost 6 months later, and I'm doing better than I was, but some of the things that frustrates me is we need, as a cancer community, to, and it's not to scare anybody or to think, oh, well, this is going to be a shit show from here on out. This is what's going to happen. Your legs are going to go numb. You're going to have a hard time. You're going to be tired. You're going to be dizzy. You can't walk. You have a hard time attending events. You get extremely tired. And it's not to scare people. This is just what's going to happen. So if you've got leukemia, and this is my stand on it, it's between you and your higher power, but your mindset on knowing what to do and what not to can help mitigate some of those symptoms, so you can live your life and participate in things that you want to participate with or in. So again, this series is about my journey on this leukemia and some of the frustrations I had. Once you've been diagnosed terminal, the medical community, in my opinion, they because of your age, because of my age, anybody around the age of 60 is it felt almost like I was expendable. They didn't want to waste their time or their efforts on giving me any suggestions, and I can appreciate that because in the past it's failed. For whatever reason, I was inspired to take the medicines that was on the second video, the DMSO and the fenbendazole, vitamin E, and it has helped me a lot. Most of the symptoms that I had experiencing, like the bleeding of the mouth, the multiple organ shutdowns, which it just your liver and your pancreas just hurt. Feels like somebody kicked you in the ribs. The brain fog went away. The pressure in my head went away. So those are the things that I experienced. One of the other thing was I would run out of air or I would get winded. When I talked to the doctors about that, they were just saying because of the leukemia and the condition your blood was in, which I had low red cells, but not extremely low. I was about around 4,000. Your blood with the leukemia in it has a hard time packing oxygen, so you become winded easy. What I did find out is if you back down on whatever your physical activity, your activity was, you could continue and do it just at a slower pace. But one of the things that I hear from, especially from cancer people, is 99% of them say, I know I was sick and I knew it was something serious. So as I went back to the first doctors that took them 14 months to figure out what I had, the leukemia, I went back to the doctors and started requesting all my blood work. And because I looked healthy, they would do maybe a half-ass blood work. They wouldn't do full blood work. So we didn't have the results we needed in order to isolate the cancer. And then there were some of them, there was one of them that actually did a pretty comprehensive panel, but when they got the results back, because of the cancer in my blood, and we didn't know it at the time, they didn't receive a white blood cell count or a platelet count. You have to run the blood with leukemia fairly quickly, or it coagulates and they won't be able to get reading on those counts. But so when I went back and requested my medical records and they sent it to me, and I see those two things are blank, which is exactly the things that we need to diagnose cancer. The doctors they told me, well, you looked healthy, the rest of your blood was good, so we weren't concerned with that. And in my case, I guess I could have been upset. It took them another 9 months to figure it out, but with my leukemia, they couldn't treat me anyway, so it wouldn't have made that much difference. It's just very frustrating that you go into the doctor and tell them your symptoms and they have a very difficult time isolating it. Me, as a person having lived through this, now when I go and have my blood work done, when I leave the doctor's office, I request a copy of it. so I can make sure that their interpretation is correct. And some of the doctors, for some reason, they get a little bit bent or a little upset that you ask for it. And this is my advice to you: is your blood work is more important to you than it is to any other doctor. So he may have looked at it, but it doesn't mean he went through it with a fine-tooth comb. These are some of the things that I've learned. So every time, whether it's in Mexico with the stem cells or up in the US, I have my blood run, I ask for a copy of it, usually because it's so crappy now. The lab calls me immediately and tells me that we have critically low white bloods, so I really don't have to wait for the doctor. They just cough it up anyway. But those are some of the things that I would say, that if you're extremely tired and you feel like you're sick, and again, everyone I've talked to with cancer says they knew they were sick, they just didn't know what it was, and they knew it was serious. It's hard to explain how the sickness you feel, because it's a body-wide sickness. But again, the bone pain that the doctors in the US dismissed in my arm and in my leg, that is a classic sign of leukemia. Absolutely classic sign. It's a dull ache. You can feel it underneath your muscles. Again, when I was peeing blood, that was kind of a weird thing, but it quit. And I haven't experienced it since, and even the urologist couldn't figure out what it was, but that's another sign that you have cancer. So that's an early sign. The itching of your legs and arms is another early sign that I had. And if they itch quite a bit and they get they kind of turn red, and if you happen to scratch them, or itch them, it'll make big red marks on your arms, almost like a bruise. But those are some of the things that if you're experiencing these things, and again, I'm not a doctor, I'm just saying you need to seek out a doctor, go have a screening done, but you need to you need to make sure that to get a copy of your labs, and you need to do your homework on the internet or whatever resources you have to help the doctors figure out what you have. And again, I don't know why, but it seems they must get a lot of people in there that just whine quite a bit, because these the cancer patients I talked to, most of them, it seemed like it took them a long time to diagnose their cancer. They were thinking it was something else. It was intermittent. And by the time they found it, it was stage 4, stage 5. All of those people that did that have passed away, whether they be 25 years old or they were 80. They knew they were sick. The doctors have a hard time figuring it out. I'm not exactly sure in my case why I'm still here. I should have, by the numbers, I should have been dead and gone by now. That's one of the things that we're gonna tackle in the next video or two, is what's the plan and how to accept the diagnosis and come to terms with you, and if you're a religious person, you and God, or you and your higher power, and try to make the best of what you have. That's one of the things we're going to do on our next video. But if you have any of the symptoms that I had, or all of them, in my case, I had all of those, which all of those are just normal cancer symptoms. And if you have multiple things, your legs swelling up, itchy arms, itchy legs, you're having a hard time breathing, you're peeing blood, those things are, may not be serious, but those are telltale cancer signs that you should go have your family doctor or your oncologist look at them and screen you for cancer. And again, I caution everyone to get a copy of their blood tests. And if you do have cancer, I would have them give me a treatment plan and then evaluate the treatment plan and see if it's something you want to live with and the success rate of it. You know, in my case, it was very easy because there was no treatment plan, and the prognosis was I was going to die. That was it. So for me to self-medicate or to treat myself, it was an easy decision. I was prompted by God or by my higher power to do it, and I did it. And so far, it's been working. I'm not cured by any means, and I still suffer with tiredness. My legs swell up a little, but my short-term memory's fixed. My pressure in my head's gone. My liver and my pancreas started working again. So I'm much better than I was in October. And again, I would be very, very hesitant to ever use the word cure, but something seems to be working. And these videos are for information. They're for, and I'm not a doctor, and they're for information only. And it's to help people understand that they're not alone. That even though it may have taken 4 or 5 months or 6 months or a year to get diagnosed, no, you're not being picked on. That just seems to be the medical community. And if this video helps that you have some of those symptoms or all of those symptoms and you're having a hard time being diagnosed, this may give you some ammunition to go in there and say, hey, these are the symptoms with leukemia. And we're not going to limit to leukemia because a lot of those symptoms are the same with every cancer. But I can only speak from my experience, which is end stage or stage 5 ALL, leukemia. So I hope this helps people, and I hope that we can get a community together that can support each other and understand that you're not alone in your fight. And there is, today, I can say there is hope. No matter what the doctors say, there is some hope, and you just may have to look at alternative treatments. And again, I'm not a doctor, so I'm not telling you what to do, but it's whatever makes you feel good. If you're getting inspired thoughts to do something and it feels good right in your chest, or it feels good in your soul, then I would probably ask you to consider those. Take a close look, even if it doesn't make sense to you. It may work. And again, I'm proof today of that it does work. I don't know how long it's going to work, but it has worked so far. And I hope this video helps people understand some of the symptoms. Heaven forbid that you've been diagnosed with leukemia. It's how the disease progresses, and that most of the stuff you're probably feeling is maybe normal. I hate to say it. Like I say, it's kind of a shit show at times, but I hope this video helps you guys out. And the next one, I think we'll address the day I was given the news that I had untreatable terminal cancer. God bless.